This video describes an ultrasound-guided electrocoagulation technique for the treatment of patellar tendinopathy. This procedure can be considered after failure of the conservative treatment as an alternative for the standard arthroscopic or open surgical excision. The patient is placed supine in the operating table in the standard arthroscopy position with the lateral bar just proximal to the knee. A foot row is used to prevent the hip from externally rotating and to maintain 90 degrees of knee flexion. After patient skin preparation and surgical draping, a transparent sterile cover is placed over the ultrasound workstation and over the probe. The first step of the procedure consists in the identification of the neovascularized area using the ultrasound imaging. The identification of this area is crucial to accurately place the stab incision for the radiofrequency probe. Preoperative assessment of the inflammatory area is performed with the color Doppler imaging with the knee at 90 degrees of flexion, but also in extension to reduce the tension in the tendon in order to have a better view of the neovascularized area. Once identified, the skin is marked with the knee inflection at the level of this neovascularized area. With the knee flexed at 90 degrees, a small vertical stab incision is performed at the level of the mark on the skin, just in front of the main inflammatory zone. This incision must be as small as possible to prevent air infiltration and subsequent image interference. A 90 degrees bipolar radiofrequency probe is used to perform electrocoagulation of the Neovessel. The radiofrequency probe is firstly identified with the ultrasound imaging. Using the imaging and Doppler mode, the probe is positioned towards the Neovessel and the electrocoagulation procedure is performed, taking care to avoid the patellar tendon fibers. After a first run of electrocoagulation, the Doppler mode is used to identify with the knee inflection and in extension the potential remaining Neovessels. A new run of electrocoagulation is then performed to coagulate the remaining Neovessels. This procedure is repeated until complete coagulation of the entire neovascularized area. Electrocoagulation procedure is concluded after having carefully checked the absence of Neovessels with the Doppler mode.